Good afternoon. Once again, my name is Dennis Ayers, and I am the host of Health and Habits podcast. And we are on We Believe Digital on the We Believe Digital platform, and we're also on Roku TV, YouTube, Facebook, and I am the owner of Ayers Insurance Group, located in Clinton, Mississippi. And you can go to my webpage, and later on you can want to review this content more and read over it over and over again. You can go to my website at dennisayers.org. That is my company Facebook page, and see that. Or you can go to my Facebook is Dennis Ayers Senior Healthcare Advisor. And also on Thursdays, we do have a talk show on 90.1 WMPR from 5:30 to 6 o'clock on Thursdays. But today, we are going to have a very interesting conversation. And you can call us. Please, we want you to engage on this thing. You can call us at 1-800-492-5186. That is 800-492-5186. And I'll say that one more time, and that is 800-492-5186. We have a very interesting article. I remember about 4 or 5 months ago, I read an interesting article in the Clarion Ledger concerning the soaring amputation rate in the Delta among black diabetics, and the one doctor trying to end it. And it is a powerful article. I got through a lot of it, but the article itself is extremely meaty and rich in material that the average person, including myself, that simply didn't know. It paints a clear picture on the outcomes, the health disparities and outcomes in the Delta area, which by some standards is one of the poorest areas in the nation. So we're going to dive into this, but first we're going to go over some stats that we got from the Amputee Coalition of America. Okay, among those living with limb losses, and we're still on the same track of uncontrolled diabetes and high blood pressure, because these are a leading factor as to why this is going on. The main cause are vascular diseases. 54% include diabetic and other arterial diseases, and that includes blood pressure. So we have over a 50% rate of amputations for those that have uncontrolled diabetes. Diabetes affects 25.8 million people. That's about a little bit more than an eighth of the population here in the U.S. About 1.9 million age 20 are newly diagnosed annually. That's annually. And this is something that I think most of us already knew, that diabetics rates vary by race. African Americans and Native Americans are at the top of that list. And the main reason that is simply because of the health disparities. The isolation of those that have limited health care in areas where there may not be a cardiovascular doctor within 100 miles. And if there's one, then there may not be another one. So, all these are contributing factors to why we see an increase in amputation, not only here in the Delta, but across the United States. But here in the Delta in particular, because this is where we live. They did a study in 1988. From 1988 to 2009, there was a 24% increase in amputations. And from 1995 all the way to 2020, there was a total of 47% increase in amputees. Now, there's different types, but the most common is below the knee amputee. Amputations, and that represents 71% of all of the this vascular amputations. And generally that happens because of blood loss, or not blood loss, but blood circulation in your lower extremities. And we're going to talk about this in just a little bit because it's very important that you know what that feels like and what you need to do something about it. Okay, we want you to give us a call at here at the station at 1-800-492-5186. That is 1-800-492-5186. Let's talk about it. Let's talk about some of the recourses that we can take to reduce our exposure. What can we do to get that diabetes under control? We're going to talk about that. If there's anything that you want to ask, give us a call. If not, then you can always check us out at Roku TV and later on YouTube. We Believe Digital YouTube channel and Facebook. Go to if you are not a subscriber, go to the address window and type in WeBelieveDigital.com or We Believe Digital, and it'll pull up that platform. And then you want to find Health and Habits. What we want you to do is we want you to press that subscribe button and you'll receive those notifications, and press the like and share this, because this is not just going on here. I have many friends in California, Barrister Nation. This needs to go viral because I think that we're all at some point dealing with this. We more so here in Mississippi than other places, but at the same token, we're still dealing with it. So give us a call, 1-800-492-5186. That's 1-800-492-5186. This doctor who is up there, and I'm gonna try not to murder his name because it's not one that you see every day, is a Dr. Foluso Faktoride, Fakorede. This gentleman is from Nigeria. He came to the United States as a child, and he started practicing medicine. And he, the story, he's got a long story on how he got to the Delta, but he made it to the Delta. And he started noticing something almost immediately when he got here. And that was the rate of amputation and the lack of doing any type of testing to determine the level of danger that's been done because of cardiovascular disease due to high blood pressure and untreated diabetes or uncontrolled diabetes. Fake the Ride, who's been asked to consult in the case, peeled off his gloves to read over this gentleman's chart. And the ultrasound showed that the circulation of his legs were poor. Uncontrolled diabetes, it seemed, had constricted the blood flow to his feet, and without it, the infection would not heal. A surgeon had typed his recommendation. It began, I will not mention the gentleman's or the patient's name, but Mr. D had limited options. And what that meant by limited options is his primary option at this point was to amputate his other leg. He already had one leg amputated as a result of, I believe, a stroke, and they wanted to take the other one. So, these are real issues that are going on here in the 21st century in a country that's by far the richest in the entire world. But there's a lot to be said about our healthcare system, especially when you have one doctor who recognizes a problem, and he's fighting an uphill battle. But we're going to talk a little bit more about that when we come back. We're going to take a break here in a minute. We want you to call at 1-800-492-5186. That's 1-800-492-5186. Or you can view us on Roku TV at your convenience. YouTube, go to We Believe Digital podcast and pull up Health and Habits and hit that subscribe button. That way you'll get those notifications. Or you can reach us on Facebook, or you can go to webelievedigital.com and see this show. We'll be right back.
The Mississippi Link is an African-American female-owned newspaper with a trusted voice that is highly respected throughout the city, state, and nation. Our motto, keepers of the knowledge for people who speak the truth, since 1993. Link significantly influences the thoughts, attitudes, and buying decisions of its readers. Call us at 601-368-8481 for your advertising needs. If you would like to receive a newspaper in the mail each week, our annual subscription is only $52 per year. That is only $1 per week for you to stay informed regarding many stories that you can only get in the Mississippi Link. Sign up today at themississippiLink.com and click on Home Delivery.
SocratesGarrettENT.com is a diversified firm specializing in recycled aggregates and crushed concrete. SocratesGarrettENT.com's recycled materials provide the construction industry with significant economic and environmental benefits by recycling clean concrete rubble into MDOT grade rock materials. Recycled aggregates and crushed concrete can be applied to driveways, road construction, bank protection, parking lots, general bulk fills, and more. For more information, please call 601-896-0084 or visit us online at SocratesGarrettENT.com.
Okay, we are back. Once again, my name is Dennis Ayers, and we are talking about an article that was written in the Clarion Ledger, and that was in May of 2020. And excuse me, and it was talking about the soaring amputation rate among African American diabetics in the Delta. And for those who do not know where the Delta is, if you're from Mississippi, you got a real good idea on where the Delta is. But it's our utmost most northwest county, generally bordering the Mississippi River, rich, extremely rich in farmland. It is not very populated, but yet we have one of the highest rates of diabetes and uncontrolled blood pressure and uncontrolled diabetes, I would fair to say anywhere in the nation. And we need to really take a good look at this, because right now most people talk about it, but they talk about it as a passing conversation. And as a result, people are dying. There is a real issue with health disparities here among the working poor. We do know that the expansion of Medicaid through the Affordable Care Act was not expanded here in our state. So what that meant basically is you had a segment of the population which we consider that are working, their jobs do not offer health insurance, and they don't make enough to qualify for the ACA insurance. So they're in a dilemma. And those people still walking around that are uninsured. And we talked last week. We talked about the cost of having a chronic disease and controlling it. The cost, out of pocket cost with that, was astronomical if you had insurance. And for those that do not have insurance, and it's even more costlier. But right now, we're talking about this one doctor who's a cardiovascular surgeon up in the Delta in Cleveland. And, he made an interesting statement in this article. And, when he starts seeing these people being amputated, having one limb amputated, his question was very simple. He indicated your legs are like twins. What happens to one leg generally will happen to the other leg. And so why was this not checked? Or there was a misdiagnosis that maybe it was, they attributed it to arthritis or something else. But from what I'm gathering, the proper testing was not only not done, but it's not even required for the insurance companies. And a lot of testing the insurance companies will not cover. And that's in part the problem that we're facing, is because if Medicare generally does not cover it, then the insurance company or that Medicare plan or that supplement plan will not cover it. So the chances are your private insurance will not cover it either. So let's dive into this a little bit more. What we did realize, especially with the onset of coronavirus, is that this only compounded the problem even more. Because right now what we're doing is we were already dealing with a disproportionate number of high black folk that were diabetic, and a lot of them had diabetes that were not controlled. But they had the disadvantage and put in that higher risk factor of COVID. And this is basically boiled down to unequal healthcare access. Unfortunately, here in America, everything or most things or we still have the race issue that we have to talk about. No one's talking about it, and they figure that everything's equal, but we as Americans need to have a real tough conversation concerning basic liberties here in the United States, one being health care. There's a bunch of other stuff, but my topic is health care. So, and I've been in healthcare for over 40 years. And, when I ran or managed the technical end of a dialysis clinic, and I did that for 22 years, we seen a lot of disproportionate of Hispanics, Asians, and African Americans that were losing kidney function due to inadequate health care, not knowing about preventative care, not knowing going to the doctor once they start exhibiting symptoms of high blood pressure. I'm here to tell you, by the time you start seeing the symptoms, chances are damage is already being done. So, but as we look closer, there were those intractable barriers were made in crucial decisions, not necessarily by the client or the patient, but by someone else, a panel of experts that worked in healthcare. Did not endorse screenings for vascular disease in the legs. And if they didn't endorse it, what that meant was the doctors didn't get paid for it if they tested for it. So, there you have your hesitation. So the law allows insurance providers not to cover the test. Why? Because those, if insurance is a little different. Each company, there's a set of guidelines that each one of these insurance companies have to go by, especially if you have an advantage plan or a supplement plan. These are some of the things that, and they will go with the guidelines of CMS or Medicare. And those guidelines, if that Medicare plan, if Medicare says we're not going to pay for this, then guess what? Those insurance plans that you have to what they call Medigap policies or the Advantage plans, they will not pay for that if Medicare deems it not necessary. So. The federal government gives student loans to doctors in underserved areas, but not to certain specialties. This is another factor, is most doctors being treated that can treat these types of complications with diabetes, or can even identify or know what to do with them. They aren't receiving that. Are able to get into that program where it would help pay for their debt. It's unfortunate, but most of these doctors that were coming in were family physicians or somewhere along that line. And this doctor, Thackray, I know I'm messing up his name, and he'll probably call me a little later on, but he'll tell me how to pronounce it. What he's saying is he knows, and his research showed, that most African American patients would interact a little bit more with the doctor and their physicians if they look like them. I know that seems far-fetched, especially here in the metro area, but that's a real thing. Because we know, and I can go as close as my own family. My grandmother did not trust anybody white. She simply didn't. But I understand because she told me the backstory behind that. And I'm not going to share that, but those backstories are all over this state. Because even after slavery, and we're not going to talk about that because, there was something that preluded where we are today after slavery, and that was called segregation or Jim Crow, which played a big factor into this. So we have a real tough conversation to have here in Mississippi, in America in general, but in Mississippi in particular, on what are we going to do? Because uninsured health care is not the answer. We know that once an amputee has taken place and they're not checked or find out what the other extremities are doing in the body, that cost goes up. Because now what you have is you have more doctor visits, more health issues, because if you are an amputee, chances are you're not exercising. One of the best ways to reduce the risk of uncontrolled diabetes is exercise, diet, closely monitored by your doctor. And all these, at some point, are going to come at a cost. For one, and for two, if you're confined to a wheelchair, or if you are diabetic and confined to crutches or a walker, what are the chances of you getting out walking 2 or 3 miles 2 or 3 days a week? We don't see that, but we do see is an additional 45, 50 pounds tacked on to your body, and you're confined to a wheelchair. We do see that, which creates other health problems. So I think that we can be proactive in this. What we're going to do is because we're down to our final 2.5 minutes, we are going to dive more into this tomorrow. And because what we do want to know is I've reached out to the good doctor. Hopefully we can get him on our show, even if he calls in, to kind of explain things to us on how this works. What we want to do is we want to amplify this and bring it into the spotlight. And I believe we can. Because there should be no place in America where this should be going on. I understand that things are tight. I understand that, but we're doing some things throughout the world, and we're not even taking care of some of those individuals that we should be taking care of at home. So that's just my 2 cent food for thought. I'm not going to get political because this is not a political show. But what this is a show about health and habits. And I think that anyone listening or watching this should find their number to their representative here in the state of Mississippi and ask them why. Ask them why. Mississippi says that they can't afford it. Who covers uninsured health care? Can you afford that? So, once again, our time is well spent. We're down to our final minute. You can reach us at 800-492-5186. We'll be on tomorrow from 3 to 3:30. You can reach us. You can also view this message again at Roku TV, YouTube. Type in "We Believe" digital podcast, and then type in "health and habits." Hit that subscribe button, and that way you'll get those notifications when it shows up. You can go to Facebook. You can go to my webpage, which is DennisAyers.org, and you can send me a message there. You can call my company number at 601-209-9853. That's 601-209-9853. 9853, or you can go to my Facebook page, Dennis Ayers Senior Healthcare Advisor. Once again, if you want to change, if you want a healthier outcome, change those habits, and we'll see you tomorrow. Thank you.
Do you have something to say? Do you want your voice heard? Join the WeBelieve.global lineup. Be the star of your own show. For more info, call 800-492-5186, option number 1, or visit online at WeBelieve.